Hi, I'm Dr. Choong Fong, consultant ophthalmologist at the International Specialist Eye Center, Kuala Lumpur. In this video, I'll be talking about watery eyes in children, and in particular a condition called nasolacrimal duct obstruction, or also known as tear duct obstruction. Watery eyes in young children is a common complaint that we encounter at the eye center. Parents can become concerned when the child has persistent watery eyes, which is sometimes associated with discharge. Often, the child gets irritated with the watery eyes and responds with eye rubbing and blinking. So what are the common causes of watery eyes? The common causes of persistent watery eyes in a child are allergic eye disease, and this can range from mild to severe form. Another common cause is nasolacrimal duct obstruction, which is due to a blockage or obstruction of the tear duct that connects the eye to the inner nose. Another condition is called epiblepharon, which is a lower eyelid condition whereby the eyelid margin as well as the eyelashes invert inwards towards the eye, resulting in the eyelashes and the eyelid margin irritating the eyeball, particularly the cornea. In severe cases, this can cause corneal injury and corneal scarring. Other less common conditions are corneal abnormalities from birth, foreign body on the eye surface, and childhood glaucoma. But today I want to talk mainly about nasolacrimal duct obstruction. So what is nasolacrimal duct obstruction? The nasolacrimal duct is a tear duct or passage that drains excess tears from the eyes into the nose. If this channel or duct is blocked, then the condition is called nasolacrimal duct obstruction. Blockage of this drainage system causes tears to well up on the surface of the eye and overflow onto the eyelashes, the eyelids, and sometimes down the cheek. This usually occurs within the first days or weeks of life. The eyelids can become red and swollen, and sometimes they can be stuck together with yellowish discharge, while normal eyelid bacteria is not properly flushed down the obstructed system. Severe cases result in a serious infection of the tear duct system called the cryocystitis. So what causes nasolacrimal duct obstruction in children? The most common cause is a failure of a membrane at the end of the tear duct called the valve of Hasner to open normally at or near the time of birth. Other causes of the blocked tear ducts would include an absent opening of the upper or the lower lid tear duct, or due to infection, or due to abnormal bony structure within the nose itself that causes blockage of the tear duct. So how common is nasolacrimal duct obstruction? It is actually surprisingly common. In fact, study shows that over 5% of infants have symptoms of nasolacrimal duct obstruction affecting one or both eyes. But the good news is that over 90% will clear spontaneously on its own without treatment during the first year of life. So how is this condition diagnosed? It's normally based on a history of tearing and discharge at a very early age. And if you have such symptoms, it is highly suggestive of a blocked tear duct. An ophthalmologist is able to perform certain tests in the clinic to confirm the diagnosis. It is important that the eyes be examined for uncommon but important other causes of tearing in children or infants, including childhood glaucoma. What is the treatment for this condition? Fortunately, as mentioned earlier, tear duct obstruction resolves spontaneously in a high percentage of cases. When obstruction is persistent, one or more of the following treatments may be recommended. Tear duct massage can be performed at home to help the tear duct open. An ophthalmologist can demonstrate this massage technique to the parent so that they can perform this at home. Topical antibiotic eye drops may be required to treat any infection that may be present. However, the antibiotic eye drop cannot unblock the occluded tear duct. Typically, if the tear duct remains blocked by 1 year old with no improvement, the ophthalmologist will perform tear duct probing, whereby a thin, smooth wire is gently passed down the tear duct into the nose to open up the blockage. This procedure is successful 90% of the time. In young children, this is typically done under a short general anesthesia as a daycare procedure. In more severe cases, or in recurrent cases, a balloon tear duct dilation or tear duct intubation may be necessary. This additional procedure is only performed if probing of the obstruction is unsuccessful. In rare cases, a more involved operation called the cryocystal rhinostomy, or abbreviated as DCR, may be needed to open the tear duct system. I hope you find this video helpful. Goodbye.